This is session number 4 out of 6 for the pre and postnatal. Have any questions come up so far for you guys? Everything making sense so far?
Yeah.
Okay, fantastic. So you guys had a little bit of homework. We were talking about diastases recti on Tuesday. So that is that separation of your rectus abdominis, the six-pack muscle, and how it can sort of like stretch out. That sheath of fascia gets a bit stretched to make space for baby. And sometimes it actually recovers, sometimes it doesn't. Sometimes it gets bad enough that it will actually unzip and you get a little bit of a herniation. And I showed you what it looks like on me with that herniation. So, and then you guys were going to figure out some ways that we could accommodate people with diastases recti if we were going to do the half roll back. So that's the one seated where you roll back, and we were going to figure out how we could help someone doing the cat stretch as they go through those movements. So what did you guys come up with?
Shall I go first?
Yeah, let's jump in.
Okay, so the half roll down is a Pilates movement. So I don't really know it, but I tried it myself, and I thought if I was really very pregnant or had a lot of weight in my belly, then I would do that movement supported by keeping my hands interlaced behind my knees, just below the knee, so that you have so that you don't roll back too far. Then I thought, is it possible to do it standing up, almost like a half uttanasana with your back against the wall as support? So I don't know if that's a variation. I thought the movement is maybe the same, going up and down.
So, standing and then sort of rolling forward and coming back up again.
Yeah.
So what's lovely about that is you'll get that same sort of mobilization of the spine, but as soon as you come into a standing position and roll forward, gravity's coming down on your back. So it's actually activating the back muscles more, with when you're sitting on your bum and then rolling backwards and gravity's coming down on your front.
Yes. Okay.
Going to load the abdominals more. So it's the same movement for the spine, but it will be different muscle loading.
Muscles. So then I thought, if you keep your feet on the floor, you could put a bolster or one of those pregnancy wedges that you have behind you against the lower back or the tailbone to stop the roll down and keep the range of movement quite small. So I thought that maybe, you like that?
Fantastic.
Or you could sit on a chair, sitting on the edge of the chair, place your feet flat on the floor and roll back until you reach the backrest of the chair, I thought. Or, this is the last one. How about if I use a large ball? I'm just reading from my notes here. If I use a large ball, and I'm not sure if that's too unstable for a third trimester pregnancy, but if you place your feet really wide for stability, or perhaps the teacher can assist with stability, rolling the ball backwards with the wall stopping the movement so that it keeps the movement quite small. So I thought that also activates the core muscles, but it doesn't create too large a range of motion.
Absolutely. Listen, I think those are all fantastic options. So I'm just going to angle my camera down onto my mat so you guys can see. So oftentimes what you specify there, which is great, is using either the wedge and hands behind the knees, taking the feet wide apart because obviously you need space for baby, and then you roll back. And this will naturally support you there. Roll yourself forward again and using your arms as much as possible. A lot of people don't have this. So even if you don't have the wedge, what you can do is take the little ball and put it in your lower back. And then immediately as you roll back, it's going to kind of stop you from going any further than that as well. And don't forget as well that as soon as baby is pushing forward, your abdominals are so stretched that literally the smallest movement is actually tightening those muscles quite a bit. You don't need to do like a normal range of movement that we would without baby in there as well. So I think those are all fantastic ways to modify and assist. And you know, using a large ball, every person is different. Some people in third trimester feel very comfortable on the ball. Some would love to do bouncing, etc. So, you know, it's a very individual thing. And then the only thing that I would add on maybe to all of those is, let's say that I've got baby in place, okay? And now if you've got that separation coming down and there's that sort of outward pulling, so what I would almost naturally do, I could put hands here, but if I'm comfortable to let go, I literally put my hands around either side of baby, almost to hold my abs together. So that as I go back, I'm actually holding my abdominals from the side, holding it in place, and then coming up again. If I need to use my hands, then what's quite nice to do is to take a band, and you can actually tie the band around, because what that does as well is naturally gives a little bit of support to hold everything together. So all of those movements are great, and then you can add some additional support if you needed to as well.
Okay.
Awesome. Cool. Okay, guys. So mine came up with quite a few options that probably you guys thought of as well. Is there anything else that you guys came up with that's slightly different you'd want to sort of add into that with the half roll back? You got pretty much the same stuff, eh, Kelly?
Yeah, I didn't
Anything? Oh, hold on a second. Unmute you there. Oh, for some reason I can't hear you, Kelly.
Oh, really? No.
Oh, there we go. There we go. Now I can hear you.
So I was doing with the band or the towel as well, the same like what you were doing with the bolster. I don't have the bolster, so I would use like a lot of cushions behind the back, because of course you haven't got hands anymore. So just to pull gently on the band, but, the same one as you were doing.
Exactly.
With the cat stretch was like, how to do the cat stretch? I couldn't work it out. In the end, I did it standing against the wall with the band, and even and holding the band as you flex, release it as you neutral, and holding it as you extend. Because I was reading also like what the bearing down on the stomach as you arch, you also need the support as well. So I couldn't think of another way on the hands and knees apart from if I did it for the person, which I might be a bit afraid to do it for them in case you're squeezing too hard. So
Yeah.
the wall one would be better, like to support the back and standing.
Absolutely. So what Kelly's talking about, and this is quite a lovely one that we'll do in our classes a lot of the time as well, just want to make sure you can see me there, is that if we've got baby in place, it's quite nice to stand up against the wall, feet nice and wide so that you feel stable here. And you can use your hands then to give support, or you can put the band around, and then literally you roll forward. So you're going to feel that your pelvis is still against the wall, and then you can do your extension, you can use your hands on your thighs to offer some support. So it's basically a standing cat stretch where normally we might be away from the wall, but if that feels too unstable, then you bring the pelvis back against the wall so that you've got some kind of support. Fantastic. Cool, and then what else did you guys come up with for the cat stretch? Any other modifications you thought of? Yeah, Bernie?
So Renee, what I was thinking, just to quickly go back to the roll-up, surely if the hernia is quite severe at that stage, could she not have maybe like lie on her back and obviously knees slightly bent, but then instead of actually doing the physical contraction, just take a deep breath in, pull the belly to the spine and just activate that area, but with no pressure on that upper section. So that's something I thought of, in addition to holding the legs one leg at a time, maybe to not put as much pressure on the gut. And then for the cat stretch, I thought, would it not be helpful to have almost like a semi-deflated Pilates ball, just to take the pressure, that we should get the stretch motion, but without any gravity pulling directly onto that area?
Absolutely. I mean, those are great props to use. So, you know, having one of those large balls, but now it needs to be one of the smaller balls, because, you know, you get them in different sizes. So like your normal size for most women is a 65 centimeter ball. Taller women and a lot of men will use a 75 centimeter ball. but you can get smaller sizes as well. So for a lot of our kids, we have a 35 and a 45 centimeter ball. So you could take like a 45 or maybe a 55 centimeter ball, deflate it a bit so that when you're kneeling on all fours, you can still touch your hands and your knees to the ground. Because with the bigger balls, you lean over it and something isn't suspended. You deflate it so that baby is supported, and then you can still do the range of movement, which is awesome. Cool, so that's a lovely prop to use. And Bernie, you're absolutely right. So if somebody is lying on their backs, and they can either lie flat with a cushion under their head, or they could be back against this wedge. And I promise you, you don't have to do anything. You can take a breath in, and you cue, give baby a hug. And I promise you, the abdominals are activating because they're so stretched already that the simple thought of tightening, or even just lifting head and shoulders up, is going to activate. And if you're doing it the other way around, where you're sitting like this, and then literally a little rounding of the spine, give baby a hug, and sit up straight. You will get such an abdominal connection when you're in your third trimester. You don't even have to do radical movements, yeah? Okay.
Can I ask?
Yeah.
About, so if you have a woman that have this separation when she's pregnant, how do you know? How do I know?
Yeah, so it's quite an easy test to be able to do on people. So what you would be doing is you would have mom, and basically it might start to present from about the end of the second trimester onwards, usually in the third, and then also postnatally, you can check as well. And it was quite interesting because I never noticed a big separation on myself during pregnancy. I mean, I wasn't checking on a regular basis, but when I did check, I didn't feel anything. But it really became evident about 3 or 4 months after I gave birth. So what you would be doing is literally lying on your back, and then all you do is lift your head. So you're not even doing your chest lift, you're not doing a sit-up. You lift your head, and immediately there's a loading on the abdominals. And you would actually just maybe start at the belly button, and you can feel down. You can use one hand, and then you can feel if there's a gap. You'll feel if there's a separation. And if there is a separation, you can then get an idea of how wide the separation is. If it's 1 finger width, or maybe 2 fingers. So for me, just up near my belly button, I can fit 2 finger widths. So I've got a 2-finger separation. If I move down, then it goes to a 1 finger width, and that's below. And then the same thing above. Above is 1 finger width, and it comes up a little bit, still 1 finger width. So you can actually, just by lifting the head, you can feel it. And it's quite interesting. It's very obvious when you have it because you can feel it. If you don't have a separation, people think, ooh, maybe I've got a separation. But if you're thinking maybe I have a separation, you probably don't, because it's so obvious when you do. Does that make sense?
Yeah. It's
You know?
just
So it's one of those things that if you've got it, it's pretty darn easy to feel.
So if you had like a class of pregnant women and they were like 2nd, 3rd trimester, would you go for the band in case, like to support them? If they were like heavier, would it be better just in case, or no need?
I just missed it there. Would it be better to what?
To support them anyway in case they might have it, because like maybe it's not as easy to notice when they're pregnant. I'm not sure.
It is. No, listen, it is actually quite easy to pick up generally. But don't forget as well, if they are seeing their gynae or their obstetrician on a regular basis, that is one of the things that can be checked for as well. So, you know, it is relatively easy to teach, and oftentimes the medical practitioner will pick up on it as well. And then I promise you, and then the woman will inform you and kind of say, look, I've got this little separation.
I don't think anyone ever checked me, and I don't think I even thought about it, to be honest.
I know me.
I just had the line. I had the deep line down the stomach, but that was it, and I didn't even think about it.
Yeah, and it is quite interesting because, I mean, my gynae also never checked me as well, but also I had such an easy pregnancy. I mean, I had no physical issues, no hormonal issues, everything actually was just like so smooth that, it was almost like a little bit of a shock that this presented after the fact. I was like, what? I never took any strain during pregnancy. So it is one of those things where keep an eye on it regardless, even if somebody's feeling fantastic. And you can get women in a class to just check themselves, and if there's like, ooh, maybe it's happening, then probably get their medical practitioner to check it out, or err on the side of caution, like you said, just then treat everyone like they do actually have that diastasis.
I think I saw someone yesterday who was very overweight who had that. And you could actually see the stomach does that. And it's because it hangs.
Yeah.
So it could be for overweight people too.
Well, it can be, but the interesting thing about that as well is that don't forget, if somebody has actually put on a lot of weight, usually that fat is underneath the skin but outside of the internal organs. So it's only the intra-abdominal fat that could be pushing outwards and causing that separation. But it can happen purely from posture, breathing techniques. So you can get that separation, even though it might not be anything from the inside pushing outwards. You can get it as a symptom almost of being overweight as well. And Bernie, is it okay if I just mention Brandon's surgeries as well?
Yeah.
Well, maybe you can just fill in the ladies on Brandon's surgery and why you think this might be happening with him.
Okay, well, that's quite easy. Just trying to arrange myself a son here. Okay, so my husband's had about 38 operations, and it would literally, the ops would go from sternum right down to pretty much the pubis. And he's one of the only people, one of 4 in the world that was born with his bladder on the outside of his body. So needless to say, he doesn't have a bladder now. But with that surgery, the amount of cuts that they had to do on the connective tissue, it actually created a natural hernia, probably about that long, because of the fact that that connective tissue has just not had the ability to connect and, grow back like it should. And it's lost its strength and its capacity. So it's stretched about this wide already, and you can see it's got no more give to actually close up. But he's got to be really careful because his muscle tissues don't connect down the entire midline, center line of his body. So any forward moving, any lifting, he can't do it. So he's obviously had to compensate with his legs to carry the weight and his shoulders. Yeah, so these exercises, everything we're doing right now are fantastic for someone who's had that amount of surgery, because they find it a lot easier, less stressful on the gut, because obviously everything pains and inflames with that amount of tension on that line.
Sure.
Yeah. So, and that's what, go back to day 1 where we were saying, we're calling this like a pre and post natal course, but it is so applicable for men and women. Anybody who has that separation, anybody who suffers from lower back pain, all the stuff that we're learning in this workshop is so applicable across the board. Yeah? We don't want to just narrow it down that now it's for ladies in their 3rd trimester, and postnatal. Start taking this and then applying it to any of your classes and with any of your clients as well. So I'm really hoping that this is probably going to help Brandon as well with finding those. Yeah. Awesome.
With that thing of,
No, you go.
Sorry, I was just going to say, and also finding the pelvic floor for him is excessively difficult. Extremely difficult. So I think somewhere along the line with all the ups, that must have had a bit of wear and tear as well. So he's got to really, he can't connect visually or from a feeling point of view of where everything is. So that's also very interesting as well. So as the practitioner, you almost have to adjust all of that on his behalf, because with enough operations, people actually lose sensitivity. They cannot physically feel that sensation we do when we think pelvic floor lift goes up, lift opens. They cannot. That there's no connection to it.
Yeah.
That I found very difficult as well. He just couldn't relate to it, couldn't feel it.
Yeah. So I mean, there's a neural connection between the abdominis and the front pelvic floor, and there's a neural connection between the multifidus, those deep back muscles, and the back pelvic floor. So as soon as we get any kind of disruption around either abdominal surgery and scarring or adhesions, which obviously Brandon will have, or people that have back surgeries, either fusions, disc issues, whatever it is, it's going to have a ripple effect to the pelvic floor as well, which is quite amazing, and a ripple effect up to the diaphragm and the breathing. So guys, that pretty much leads us directly into the next topic that I want to talk about today, which is called hypopressives. So I'm going to go to our manual, just to do a little bit of a screen share with you. This is on page 12 of your manual, and hypopressives, as described on the website for Hypopressives UK, hypo means a reduction or a decrease in pressure, whereas most traditional exercises we do, so abdominal exercises, crunches, obliques, roll-ups, those actually increase intra-abdominal pressure. They are actually considered hyperpressive exercises. So specifically with hypopressive technique, we're talking about how the pressure relates to our thoracic cavity, abdominal cavity, and pelvic cavity. So don't forget that as we breathe in and out, we can actually change the pressure in our lungs. Our thoracic cavity, we can increase and decrease pressure with breathing because we're taking air in and out. We actually cannot do that with our abdominal and pelvic cavities, okay? That actually maintains its own pressure. It's called an intra-abdominal pressure, and it is contained by the diaphragm, the pelvic floor, the TA, and the multifidus. That is your core unit. Now, if we have pressure in those cavities, it will find the weakest point, and it can cause all kinds of medical conditions, sorry, I shouldn't say medication conditions, medical conditions like incontinence, prolapse, hernias, for example. And for women that have had a baby, they're likely to have experienced internal pressures and on already weakened structures. So they're going to be much more susceptible to having all of those issues, okay? Because they've had that pressure from pregnancy and then perhaps some damage to pelvic floor, etc., diastases recti. So hypopressive training programs work on the core muscles, which help us manage pressure, first of all, consciously, and then hopefully subconsciously. So guys, that's pretty much what we're doing with Pilates. Also with yoga, if we're cueing clients, we do a lot of very conscious work, consciously connect to the pelvic floor, consciously connect to the abdominals. But at the end of the day, we want people to be able to integrate that information so they don't have to think about it anymore. So when they're walking about with their daily activities, it's just going to kick in naturally. That's what ultimately we're aiming for. So doing hypopressive exercises will start to increase, in other words, improve resting tone of the muscles, and it will help them to function involuntarily, in other words, subconsciously. So our core will start to work as it was designed to. So that's the whole philosophy behind hypopressives. Now, just below that, I've got a little bit of a blurb about low pressure fitness. So just to let you know that I did this course called Low Pressure Fitness with Shirley Borson. She's based out in Durbanville. She's also a Pilates instructor. And I did low pressure fitness training with her to learn this technique. And basically what low pressure fitness is, hypopressive's technique tied into very specific postures and positions, standing, lying down, kneeling, etc. She has now left low pressure fitness technique, and they have now started Hypopressives South Africa, Hypopressives SA. So she is still the head of it. It's just that they went back to the original technique. And the reason being that low pressure fitness was actually designed by someone in Spain. And it's a fantastic technique, but it came down to all kinds of issues with translations from Spanish to English and to other languages. And also they wanted to remain based in Spain, I believe, and then it became all kinds of issues with the franchises. So it's the same technique, it just happened to have specific exercises tied into it with low pressure fitness. But if you want to get in touch with Shirley, I'll put her number into our chat box. You can always get in touch with her, but if you look now for Hypopressive South Africa, you're going to come up with Shirley's details and you can get in touch with her as well. She's been great in the past with actually running workshops at the studio. So if she does one, I'll definitely let you know and you guys can join in possibly. Okay. So let me just go back to this little share screen. I'm going to show you a video on this as well. So hypopressives and low pressure fitness have been shown to positively affect the pelvic floor. It helps with prolapses, so you can oftentimes get a bladder prolapse, a rectal prolapse, and for women, you can get a uterine prolapse. So basically where things drop down. And you can also obviously suffer from diastasis recti. So this is why I'm bringing it up now, because it's such a valuable technique for this. It's great to incorporate it within Pilates and yoga sessions, but it's very, very specific. It's a simple technique, but the very specific positions, the breathing, etc., it really means that you should be doing this with a teacher to guide you, or to go and do a training course with Shirley so that you're able to actually translate that information for yourself as well. So I'm just going to show you this little video. I'll do my screen share here.
Aloha, this is Dr. Summer Nicole of Yoga Doctors TV. I wanted to jump on and give you guys a quick explanation of what hypopressive breathing is and what low pressure fitness is. So there's a distinction between the two, so I just wanted to clarify it for those of you who are out there searching for these terms or in need of this work. So hypopressive means low pressure. So hypopressive breathing literally means low pressure breathing. And it's actually a breathing technique you may know as the abdominal vacuum technique. If you're a yogi, it has similar effects to true Uddiyana Bandha. So it's a passive lift of a relaxed abdominal wall. So it creates this sort of suction or vacuum look of the abdominal wall. And that breathing technique is in and of itself a breathing technique. What low pressure fitness is, that came around in 2014. Tamara Rial and PD Pensac created the company called Low Pressure Fitness. And what they did is they took the hypopressive breathing technique and they paired it with these specific exercises with specific technical postural cueing to create core and pelvic floor restoration programs. So there's 3 levels of it. I teach this to clients with that are healing from prolapse, incontinence. For men, it mostly is like hernias. Men that have hernias, it's the only thing I really know. that actually heals the tears in the tissue from hernias, as well as diastasis recti, which is most common in pregnant women, where you get a split of the midline of the abdominal wall. And low pressure fitness heals that as well, because the tears in the tissue, there's tears in the tissue, and it's healed by this eccentric strengthening. That's a part of low pressure fitness. Eccentric just means you're lengthening and contracting your muscles at the same time. So it's low pressure fitness, or LPF, is considered like a revolutionary breath and postural method. And it has a lot of different benefits, not only postural re-education and respiratory improvement. You have the pelvic floor restoration piece of it. Anyone that does it, you naturally get a waistline reduction, because it reshapes you from the inside out, and as well as sexual enhancement. So it actually can improve for women that have a hard time coming to orgasm. It can improve that, as well as for men, some men that have ED. So some of the three main characteristics of like hypopressive training, you could say, are number one is that it decreases pressure in the thoracic, the abdominal, and the pelvic cavities. That's the main kind of magic of the method, which is when you have too much. You have conditions that are a result of too much intra-abdominal pressure, like when things are bulging outward, like prolapse or hernia. You have to get to the root cause of that, which oftentimes is just too much intra-abdominal pressure. So it's reducing the pressure. So instead of feeling pressure on the pelvic floor, it literally flips that pressure internally. So you feel more of like a lift up on your diaphragm versus like heaviness on the pelvic floor. Another characteristic of hypopressive training is that it turns on the deep core muscles the way they're meant to function, which is synergistically all together at once, and reflexively, meaning automatically. So very different than how like our fitness industry tells us to train the core, which is actively and consciously. So if you've been injured at all, you have to turn on those deep core muscles, how they're meant to function, which is synergistically and reflexively. And the other characteristic of hypopressive training is that it helps to normalize the myofascial tension, or you could say the resting tone of the abdominal wall and the pelvic floor. So I would highly recommend, if you're in need of this work, that you definitely work with a teacher. It's very, make it hyperpressive, adding pressure and contributing to your problem if you're doing it incorrectly. So I highly recommend working with a teacher. I'm out of Kauai. I see a lot of clients over Zoom. I can teach it through Zoom over video conference. So if you're looking for any recommendations or suggestions, please feel free to reach out to me. I'm going to leave a link under this video for a free gift that's on my website, and that gives you 3 self-assessments for kind of if you need this work, self-assessment for your diaphragm, for your abdominals, and your pelvic floor. And then another video on that same page is an intro to hypopressive breathing. So just give you a little intro how the basics of the breath work. And please let me know if you have any questions, and please feel free to share this. A lot of people are in, a lot of women especially are in need of this work, and they don't know. And a lot of gynecologists or even physical therapists don't know about this work yet, and it's highly effective for a lot of these common women's health issues, as well as hernias, and it just has really good overall effects for this. So I'm so behind it. So please let me know if you have any questions, and I hope you have a beautiful day. Aloha.
Oh, okay. Now,
Welcome to the Flower
hold on a
Empowers.
second.
Coming next, we are going to go through a little hypopressive exercise, or what's known as Uddiyana Kriya in yoga.
Sorry about that, guys. I was trying to go back so we could actually just get that link for you. Let me just have a look here. Pause. Okay, so I'm going to do a little copy of that video clip and put it into the chat box. So if you guys are keen to take a look at those assessments that she's offered there, then you can check her out there. All right. All right, so I thought she gave just a very nice explanation about what hypopressives is, but it still hasn't really given you an opportunity to experience it. So that's what we're going to do now. So here's the other thing is that, you know, when I did the training with Shirley, You can use this work with women during pregnancy, but you do have to be a certified practitioner to start teaching it, because there are lots of modifications and certain contraindications, etc. So I don't teach this to any women that are pregnant, just because, you know, I've done the training, but it's not my area of expertise. I'm very, very happy teaching it to anyone else, especially postnatally, because I just think it's made a big difference for me, and I see the value in it as well. The other thing that you want to be aware of is for any women that are menstruating, you cannot actually have either a tampon or a menstrual cup inserted when you do this, because there is this natural vacuum and this lifting of the pelvic floor. If there's something inserted, it will get sucked right up. Okay, so then you will actually just say to women, look, if you are menstruating and you have something inserted, please don't do this, or rather actually just remove it and just have a sanitary pad in, because that's fine. Okay, it's just that you cannot actually have anything inserted that might get drawn up too high. So I'm just going to explain the breathing to you, and then we're going to hop onto the floor together and we're going to go through it. I'm going to show it to you first because there is a lot of details that are connected into this. So the first thing, guys, is the breathing. Oh, okay, cool. Sorry, Maya. So if the her voice was very, very soft. So when you click on the link, then hopefully if you have some earphones in, you might be able to hear it a little bit better. Cool. So the breathing is an inhale through the nose and an exhale through the mouth. So when we were originally taught, we were taught 4 counts to inhale and 4 counts to exhale. But when I did the latest update with Shirley, we did a longer exhale. So it's about 3 or 4 breaths, counts to breathe in, and then a slightly longer exhale. So it basically looks like this. Okay, so inhale through the nose and exhale through the mouth. We do 3 sets of those, and then on the last one, you seal the lips, there's no airflow, but you do what is called a false inhale. So you actually lift the ribs out to the side, which causes the vacuum. And you know how you can tell is that you start to get, this is called the sternal notch. You see tension and pulling in there. So I'm just going to show you the breathing here. I'm going to do the inhale, the exhale, the inhale, the exhale, the inhale, the exhale, hold the breath. It's a false inhale, and then you break the cycle with a sniff in. Okay, so it looks like this. Could you see all that activity up there? Okay, so now that is only happening because of the pressure that I've created. So now I'm going to show you what my ribs look like. Okay, so again, sorry, I am going to flash you guys. Okay, so I'm just going to move this down a little bit so you can actually see what my ribs are going to do. So if I'm sitting here, okay, so I'm just going to do 1 breath in and out. Now, guys, nobody likes to let this be floppy, but it needs to be a soft belly in order to get the vacuum effect. Because if you connect, then you can't cause that pressure. So this is what my ribs are going to look like. I'm going to do 1 normal breath in, 1 normal exhale, soft belly. Now I'm sealing my lips and I go. Okay, That lifting of the ribs was when this was tightening, and I got that dip in the sternal notch. So those two are connected. Could you see what I was doing with my ribs there? Okay, and it's a soft belly. So now I'm going to, guys, there are so many different positions you can actually do this in. The other thing that people don't realize, you know the serratus anterior muscle that comes underneath the ribs here, okay? It is very closely connected to our breath. It helps to set the placement of our scapula and our ribs to facilitate breathing. So this is huge emphasis in hyperpressives and the different positions about the arm placement, which is why you want to make sure you're doing it and you're teaching it properly, which is why you want to do the course ultimately. So when I teach this, or when I do it myself, one of the positions that I really like is standing against the wall like this. And then there's a push and a pull with my hands that helps set my scapula right here. So this is one of the positions that you can teach people to do the hyperpressives. You can do it in this position here, which is quite nice because then you can really let your belly hang. It's quite a nice position to be in. You can do it in a 4-point position. And then the one that I really like, which is the one you guys are going to do with me, is lying on your back. So I'm just going to show this to you, and then you guys are going to try it with me. Okay, so let me just show you. You want to have, like normally we lie with our knees at about a 90-degree angle. We're actually going to slide our feet a little bit away, just to switch off the hip flexors. And then you want to find a little bit of length along the back of the neck. You're going to dorsiflex the ankles. Now, because you want the pelvis in neutral, you may need to push with your feet to find neutral, but you can see when I do that, it tilts my pelvis, right? So what I need to do is almost a little bit of a pull with my heels to get myself into neutral. And then I'm digging my heels down. So it's quite active through the legs, but it's really soft through the belly. And now I've got my neutral position here. Palms up, fingers are pointing towards each other, just above your chest or your heart. And it's active. It's crazy amount of work in the arms, guys, but that's because we need to activate serratus anterior. So now, this is what it's going to look like. And I'm going to show you so you can see the rib cage movement. So I'm going to do my 3 sets of breathing. And I would do 4 sets of that total before I relax and move to another position. Okay. So when you do that false inhale and that lifting of the ribs, I aim to do that for about 8 counts. Okay, so it's quite a long false inhale that you want to be able to hold it for. Okay, are you guys keen to try it? Would you like to have an experience of it? Okay, so I'm going to talk you through it. So guys, lie down on your backs, and you don't have to have your camera on you. If you want to, that's fine, and then I can check your position. But lie back, and then don't do anything with your arms yet, because your arms, whoopsie. There we go. So your arms can get very, very tired. So what I want you to do is to have your heels just a little bit further away from you than normal. And then just flex your ankles so your heels are connected to the ground, toes are lifted. And then just try pushing your heels away and then pulling your heels in. And you're going to feel that there's a little bit of a rocking action of the pelvis. And then I want you to get your pelvis into a neutral position. And whatever your feet are doing, whether or not you're pulling or pushing, you're going to stay there and just anchor your heels down. And then make sure that you're lengthening your spine. You've got your chin tucked in very gently. And then bring your hands up above your chest, palms facing up to the sky, fingers pulling towards each other, and bend your elbows slightly. Good. So, Kelly, turn your hands up. Yes, but don't interlock the fingers. Have them separated. Separate your hands, guys. That's it. Bend your elbows slightly, and then think of pressing upwards without straightening the arms, and you're going to feel the serratus muscles activate. So stay there for a moment and soften your belly. I want you to start breathing in through your nose. 2, 3, exhale through your mouth. 2, 3, 4, and inhale. 2, 3, exhale through your mouth. 2, 3, 4, soft belly, inhale through your nose. 2, 3, exhale through your mouth. 2, 3, 4, seal your lips and false inhale. There's no breath moving anywhere. Your ribs are lifting. The belly is soft and pulling in. And we inhale. 2, 3, and exhale. 2, 3, 4, and inhale. 2, 3, bend the elbows slightly, exhale. 2, 3, 4, and one more time. Inhale, soft belly, keep tucking the chin gently, exhale. 2, 3, 4, seal your lips, false inhale, feel the ribs expanding, wide, soft belly, keep false inhaling, and inhale, 2, 3, and exhale. Just allow your arms to relax, allow your feet to relax, and you can sit all the way upright. I know that's hard on the wrists, hey? Okay, so how did it feel? Could you get the sense of that false inhale? Because, you know, we all come from a background where we understand breath work. Your average client is having a hard enough time breathing as it is. So to teach that false inhale is quite difficult. Yeah? How did it feel for you guys? Could you feel that there was a bit of a vacuum?
Yeah.
Awesome. Good, Bernie.
Yeah, I've done a lot of, absolutely, Renee. I've done a lot of Kriya breathing. So that's the way you explained it. Brilliant. It was such a, it's like breath with no breath. Brilliant explanation.
Yeah, it's like Uddiyana Bandha.
Yeah. Fantastic. Could you get that connection as well? Hey there, Maya.
Yeah.
Awesome. So, you know what? It's worthwhile exploring that technique of breath. And yoga tends to include so many more forms of breathing than Pilates does. You know, so you'll have your Ujjayi breathing, you've got the Kriya breath, you've got your fire breathing and Kapalabhati, you know, and including this now hyperpressive where you can actually start to break it down a little bit is very valuable. But you can see the setup is so important. And when we did this course with Shirley, she did a lot of hands-on work, which is great. Because, you know, with your hands up here like this, oh, they start to get tired. Yeah. So she comes and she'll put her hand here and then you've got to push against her, you know? So having that tactile cue is like really valuable as well. Okay. Cool, so guys, that is hyperpressives, and I think it's invaluable for pelvic floor connection because it's that lifting and the diastases. Maya, were you going to say something?
I did want to ask something. Thanks, Renee. I was wondering if you could in a yoga class for pregnancy do the reed lock, the abdominal lock, and the throat lock instead of, and then or Veloma breath, the 3-part breathing, for instance, feels the same to me. And do you think it's safe to do during pregnancy? Can you do locks during pregnancy?
You know, to be perfectly honest, I stay away from a lot of locks during pregnancy, simply because so many people, as soon as they go into a lock, they stop breathing. And don't forget that you are providing that oxygen supply.
Yeah.
So this is why I'm saying is that in pregnancy, I think you need to be an expert in that whole hyperpressives technique, because you're doing the false inhale and holding the breath, that you wouldn't want to present that to pregnant women. So any of that holding of the breath and the locks. Having said that, if I go back to our manual here, if you take a look at the bottom of page 12, we talk about a bandha, and a bandha is a lock, okay? It's Sanskrit for lock that's used in yoga. And it's when energy is drawn to a certain area and then closed off. So very specifically, Mula Bandha is your root lock. And it's exactly the same thing as a pelvic floor connection that we talk about in Pilates quite freely. So, but the difference being that when we do pelvic floor work or when we do Mula Bandha connection, you don't necessarily have to hold your breath. In fact, we encourage women to keep breathing as they find those connections as well. So, you know, you could perhaps even do like chin lock, etc., as long as women are still breathing. That would be the most important thing that I would focus on there.
I think what I forgot is that this is also post-pregnancy.
Yeah, exactly.
Sorry, so of course these exercises are for postnatal. I wasn't thinking clearly.
Exactly.
Yeah.
So this is where I start teaching it, is with average clients, like average clients as in non-pregnant clients, okay, or postnatally, if you've got a separation or if you have a herniation or if you've got a prolapse or any kind of incontinence issues, this is fantastic rehab work to do. And if it's something that you want to incorporate during pregnancy, then that's when I say, look, you actually now need to go off and you need to do that training, become like an expert in this area, which I'm not. I've done the course and the training and I integrate it into what I do, but I'm not a hyperpressives practitioner or educator. All right, cool. All right, so what we want to do now is start moving on to a little bit more of the repertoire that we were focusing on. So we're going to scroll down to page 24 of our manuals, and I'll do a screen share with you as well so that you can have a look here. So on our session on Tuesday, we did thoracic rotation. But there's a lovely exercise that you can use as a little bit of a modification or perhaps as a warm-up, which is thoracic mobility here. So this is a side-lying exercise, and it's quite nice to have your head either supported on a cushion or with your bottom arm. You can have the little block between the knees to offer support for the sacroiliac joint and the pelvis. You could have a little pillow or a bolster underneath the belly so that baby is supported as well. You get all the props you need. And then you take a ball. I like to use one of the soft over balls, and all we do is a gentle rolling with the arm movement there. So guys, get yourselves onto your mat. You can use any of those other props that you want. And I'm just gonna change my speaker view so that you guys can see. And what I'm going to use today is my restorative bolster to give myself a little bit of a prop underneath my head. I'm going to have my small inflatable ball ready in front of me. And then I'm going to use my foam block. You can use anything else if you want between the knees right there. So I'm just going to have my arm here. You can actually place it under your head if you want. And you're just going to let your arm rest out in front of you and get your knees bent in an angle that you feel that your lower back is comfortable. And all we're going to do is start rolling the ball forwards and backwards. And it is such a small, gentle movement, but can you feel that if you're keeping your elbows straight here, that the movement actually has to come from the shoulder, which is then going to have an effect on the rib cage, and then it's going to have an effect on the thoracic spine. So it's just a wonderful way to create some mobility around the thoracic spine. Very, very soothing action here. And so then oftentimes what I do is I'll keep people in this position, and then we'll just stay here and we'll take a little bit of a break. And you can just leave the ball if you want. You can give baby a little bit of a hug. And then just bring your knees a little bit away from you so that you can feel a connection to the lower belly. And remember, guys, you can support baby if you wish, okay? And we're going to go into the clam and the reverse clam from here. So just start by lifting your top knee, keeping the feet together, and then lower the knee down. And now keep your knees together and lift your top foot up. So now you're going into internal rotation of the hip. And release your foot down. And then lift your knee up again. And bring the knee down. And again, you're going to lift the foot. And so you can feel as well what's quite nice here with the block or the support between the knees, that you're still maintaining pelvic alignment, right? And we're going to go just one more time. Open the knee up. There's your clam. And that's lovely for strengthening into the gluteals. And then lifting your foot up. And that's getting the internal rotators called the TFL. And releasing the knee down. And you can rest there again. Just bring your hand once again onto the ball. Sliding the arm out, and let's just go into our thoracic mobility again. So you can see how I use this just sort of in between each of these side-lying exercises to almost create like a little bit of a break, to change the muscle focus. Because remember, we don't need to work to fatigue, especially during pregnancy. And then we're going to stay here, and you can keep your hand resting, or you can just move the ball, provide a little bit of support so that you're holding baby. And now, take your top leg and stretch it out long, and you're going to flex that foot so you're pushing out through the heels. Now, by the way, this already is going to be loading the abdominals, because don't forget that everything is stretched out here. So even just holding your leg in the air is going to be an abdominal workout for mom in her third trimester. And so now lower your leg down towards the floor without actually resting, and then lift that leg up again, and see if you can bring your leg a little bit higher than your pelvis. So now you're connecting into gluteus medius. And again, we're going to lower. And you're going to lift up and give baby a little bit of a hug as you exhale. And again, we're going to breathe in. And you can use your hand to support baby here. Exhale. Give baby a little bit of a hug, supporting your lower back. So this is side-lying gluteals, guys. So you're going to now feel those lovely connections onto the side of the hip here. Gluteus medius working. Let's do one more time. Exhale and lift, and then bend your knee in, relax, and then once again you could go back to that thoracic mobility. Oh, great, and I see Grace is joining us. All right, so How did that feel? Hi, Grace, how are you? Nice to see
Hey, how are you? Yes, absolutely. Hi, everyone.
Cool. Okay, so Grace, just to give you a little bit of an update and you'll be able to catch up on the recording, we spoke about hypopressives technique this morning, and I think that's going to be quite relevant to what you were asking about with connecting into the transverse abdominis and how to help to correct a diastases recti. So make sure you watch the beginning of the video because that's very relevant to what you're interested in, I think.
Okay, cool. Thank you.
Cool, pleasure. And so now we've just started in on a little bit of the repertoire. So we're taking a look at page 24 of the manual. And it is our thoracic mobility. And it's such a gentle, relaxing movement. So it's just a little bit of a rocking action that we can do. And it's just quite nice to insert it sort of in between each of these other movements that we can do, including the clam and the reverse clam, which is on page 26. So we just did that right now as well. It's the same setup here. So you see that it's quite lovely to give women a little bit of support underneath the head. Maybe they can use a pillow underneath baby bump to support baby. Really nice to have your hand there as well, because don't forget that that gives you a tactile cue to engage abdominals and pelvic floor. And then I like to keep a block or a little cushion between the knees to help pelvic alignment. So guys, when you open your knee upwards into the clam, that's going to be connecting into the gluteal muscles, so gluteus maximus, but also the piriformis muscle. And then when you lift your foot up and you get internal rotation at the hip, that's going to be doing more of a connection into the front of the pelvic muscles, which is the TFL, the tensor fasciae lata. But all of those muscles help to stabilize the pelvis. So when you think about how women during pregnancy, you can lose a lot of stability around the pelvis. These muscles are so important to maintain connections to. And a lot of women might find that they get connections very easily on one side, but not so easily on the other. So you want to get a little bit of feedback on that as well. And then I did that exercise, and then we went back to the thoracic mobility, and then we went on to page 27 right now, where we did our side lying gluteals. So that's this one right here, and I actually just let that little foam block or the bolster rest on the knee because I knew I was coming back again afterwards to do thoracic mobility. So this is more about getting a connection into the gluteus medius. And don't forget that the gluteus medius is, I think, so important for holding the pelvis together. This is the one that helps to stabilize the sacroiliac joint and the lumbar spine. Really, really important to maintain those connections as we go through pregnancy as well. So guys, how did that feel for you as you did that little routine? Because it's a lovely sequence to be able to do, you know? Little focus on upper body, take it down to the pelvis and the legs, bring it back, and then you could even add that thoracic rotation that we did the other day, and then you go back to the lower body and you do side-lying gluteals. Yeah? Feel quite nice?
The arm extension with the ball was so soothing.
Very, very soothing. Absolutely. I quite like that one. And I know this is a little bit off the topic and a bit random as well, but we've got one of the trainers here, in fact, a couple of the trainers that have done a little bit of a specialization in working with women that have had breast cancer, lumpectomies, mastectomies, and then, you know, the huge effect that it has, you know, if you have your lymph glands removed as well, there's a lot of scar tissue, and this is one of the most soothing exercises that you can do just to be able to start that rehab process as well. So again, looking at this going, great, this is wonderful for women in their third trimester and postnatally, but start thinking out of the box about, who else could this be really, really nice work for? And that thoracic mobility is great for anyone who's maybe having chemotherapy, radiation, or surgery. Okay. Cool. Any questions on those? And you guys remember why we're using all these different props and all the supports, yeah? You're gonna need probably every single prop that you can pull out. And if you're doing Zoom sessions, this is where you just tell mom to go and get like the pillows off the bed, to go and get the pillow, the cushion off the couch, etc. Fold up a towel, use as many props as you need. And by the way, and this was a huge thing in lockdown, is that everybody was saying, great, you know how everybody went on that massive toilet paper buying spree? And now we've got like a supply of toilet paper for the next 20 years in our homes, right? Okay. So if people don't have a bowl, you take a roll of toilet paper and you put it underneath the hand and you can actually keep rolling, or you get a tin of chickpeas or a tin of tomatoes, which we also have like endless supplies of now, right? Okay. And you can actually put your hand like on a tin and you can just roll the tin as well. So, a lot of people might not have this prop, but I promise you they're going to have toilet paper or a tin of canned food. And they can use that as well. All right. Cool. Any questions before we continue on with a little bit of repertoire? Everyone good? Fantastic. So we're going to go down onto the next one, which is on page 28, and it's called the WAG. So again, I'm just going to do a little screen share for you. So the WAG is in a 4-point kneeling position. And it's basically, if you think about like a happy puppy and how they wag their tails from side to side, and then you can look over one shoulder and look for your tail. So it's lateral flexion of the spine. Just like we did on our very first module where we're standing up against the wall and we did that lateral flexion or the windscreen wipers against the wall. It's just that we've gone into a different position here. So guys, looking at this picture of Annie here, what are some issues that you may immediately come into mind of how you're going to have to modify or assist someone in this position? What are some things you've got to consider?
Well, definitely your lower back.
Absolutely. So now, if someone's lower back is taking strain in this position, what do you think you could do to assist them? Any ideas?
Couldn't we go back to the ball?
Absolutely. So you were talking earlier about taking one of the large balls, but deflating it quite a bit, and you could place that under baby bump so that you've already got a little bit of support for the belly. Fantastic. Now, what if you don't have a large ball? What else could you do?
A chair.
What would you do with the chair?
No, it might not work if you want to do the WAG movement, right? The chair's going to be a little bit limiting.
No, but you know what, you're right. So basically, if you actually sat on a chair, and then you can actually just do a little bit of a leaning action from side to side. So that's going to give you the same lateral flexion of the spine. Absolutely. So seated in a chair, lovely modification. So guys, what are some other issues, if you look at this 4-point position, that somebody could encounter during third trimester?
I was just wondering, the wrist. So I'm obviously having pressure on the wrist. I would think you always say roll up the mat. So maybe rolling up the mat for comfort. And then I just wanted to ask, with a pezzy ball against the bum, would that work? So you put the pezzy ball against the wall, and then she's in 4-point kneeling, and then she relies her weight against the ball and like almost does a wag type of movement. Would that work as well as a modification?
Yeah, would she go sideways to the ball, or where would the ball be in relation to where she's kneeling?
So the ball's like directly against the bum and anchored by the feet.
I think that would be a great modification. Absolutely.
Okay,
So
good.
what's nice about that is that even just having your pelvis and your feet anchored, it makes it more stable. It makes it almost like a little bit more closed chain, which I think would be a great help as well. And then what Grace was talking about, guys, is so many people take strain on their wrists regardless. And then especially during pregnancy, if you've got a lot of relaxin going through your body, you might find that your joints become like a little bit less stable. So you've got to be quite aware of the wrists and the hands. So Grace was mentioning rolling up the mat and placing it underneath the hands, which is perfect. I would also suggest that maybe you put like a box, you know how you get step aerobics boxes or reformer boxes, or even a low chair, and you rest your forearms on the chair as well, because that'll remove the weight completely. Or you can go onto your fists even, right? So be prepared with all kinds of modifications like that. And then the other one I find as well that really helps with the lower back, by the way, is to take the knees a little bit wider apart. So as soon as you take the legs a little bit wider, it creates a bit more space so that the lower back could then maybe go into a little bit of a rounding. And then guys, if you're in this position and somebody has that separation, that diastases, what do you think you could do to help?
I thought that maybe to move it into a seated posture so that it's sukhasana instead, you know, to have a cross-legged position, because then you can do the cat-cow as well as the wagging of the tail.
Absolutely. So you could move this completely into a seated position, or quite frankly, is there any reason that you have to have your hips stacked above your knees? I mean, you could actually move back a little bit, right? You could almost sit back in this position a little bit more, and then you could actually do this exercise.
And maybe put a bolster in between the sit bones and the heel bones so that there's more support.
Absolutely. Place something behind the knees so that you have your bum supported slightly. And then
Renee,
sorry, Bernie, yeah?
No, sorry, apologies. Could you also not maybe go into a supported child's pose, not with the belly, but more like Maya said, pop something under the bum, between the bum and the legs, and then come down on the forearms. So it's still giving you the space and the mobility to move side to side. Could that not maybe work, or is that also a bit...
Yeah, it really depends on how big baby bump is.
Yeah.
So some women, baby is so big that as soon as you come down on the forearms, baby is resting on the floor. So it could work, or it might not, depending on the size of baby.
Okay,
yeah,
sure.
but that would be a great modification. And then don't forget as well, if somebody has a separation, you could take a TheraBand, some kind of support, and tie it around the belly, because that's actually going to then offer some support of holding the rectus abdominis a little bit more together. So all of those modifications that we've just spoken about right now, you could very well apply to the cat and the cow, or if you're a Pilates person, you might know this as the full cat stretch. Okay, so guys, let's come on to our mats. Let me just change my speaker view there so you can see. And we're going to try all of those variations to see what works for us. Okay, so let's do this with absolutely no props. If you want to use the ball to give you a sense of what it's like to have baby there, then please do so. So it gives you a little bit of an awareness. And then coming onto all fours, just set yourself up as you normally would. And we're going to start off with the wag, and then we're going to do the cat and the cow. So start off just by wagging your tail from side to side. And don't forget that the abdominal muscles are already stretched out. So this wagging action is going to give you a pretty strong connection into the abdominals, even with a very small range of movement. And then if you wanted to, you can look over the shoulder and see if you can find your own tail. So it's a little bit of a wagging action there. And come back to the center. And now we're going to add a few props. So if you have a hair band, why don't you take the band and tie it around your belly so that it's going to help you if you've got any kind of dragging or diastases. You're going to feel that this is going to hold you together a little bit because it's very difficult to take one hand and hold yourself together like you might in some other exercises. Now let's also pretend that we've got some lower back issues. So maybe what we're going to do is take the knees a little bit wider, sit back a little bit so that you're not loading the lower back, and maybe you want to do a little bit of a tuck with the pelvis, right? And then let's pretend that we've got wrist issues. So you can either go in a fist, or maybe what you're going to do is put your arms down on a block or a chair, or you may be going to roll up the mat like Grace suggested. So now from here, we're going to do a little wag of the tail. We're still getting the same movement and the same connections into the obliques, but we have modified so that it works for us. And then maybe you want to do a little bit of a look over that opposite shoulder. And then come back to center, and you can make your way all the way up. All right, now you might very well take like a little bit of a rest in the middle there, but we're going to move on to the cat stretch, the full cat stretch. So again, let's do a few little modifications here. So let's say that we're going to have us seated back a little bit, because that's going to stop that downward drag. Guys, I think I mentioned this in our first lesson. When I was in my early 20s, I did my pre and post natal training back in Canada. So I knew all the theory of it. And everybody teaches you, oh yes, go into your cat stretch, the 4-point kneeling, it feels so soothing. And then finally, when I was pregnant at the age of 39, I hated it. If you put me into this position, I was seriously unhappy. I felt like everything was getting pulled down this way. So you just realize quickly that you might know the theory, but it feels very different for a lot of people at different stages in their pregnancy. So it's always worthwhile checking in and sort of seeing, well, how does that feel? So the way that I used to modify for myself, instead of going into a 4-point position, I used to do this. Now, I didn't use this bolster, but I used to use a folded up towel. And I came here, okay? So guys, just try this position, see how it feels for you. And what's also nice, pressure off the wrists, pressure off diastases, pressure off your lower back. And now we're going to do our cat stretch from here. So you're going to round your spine, give baby a lovely hug. And then we're going to lengthen the spine. And you could go to neutral, or maybe you want to just lift your chest and the eye line a little bit, so it's thoracic extension. And again, round the spine. Pull baby in towards you. And then lengthen your spine. And don't forget, if this doesn't feel comfortable to arch the lower back, if baby is pulling too far, then just hold neutral position. You don't have to go any further. One more time, and we're going to round the spine. And then we're going to lengthen. You can move to extension if it feels good for you. And then you can return to neutral. Okay. So those are some very common modifications that you might use for the cat and for the cow. Okay. How did you guys feel with that? All right? Awesome. Glasses. Okay, so let me do another little screen share with you, so we can just go over that repertoire.
I ask you a question, Renee?
Of course.
So, you said that you didn't find that very comfortable when you were pregnant, like third trimester. Do you think that's the reason, because you had that separation, that you felt more pressure there?
Not a good question. You know, I don't know, because all the other stuff felt okay for me. I mean, I felt like a strong connection to my abdominals still. It wasn't that I suddenly felt like I didn't have control over it. It just felt like this immense drag. So it may be in hindsight, I mean, I never thought about it, but maybe in hindsight that was like a signal that this is separating. But you know, all the other stuff that I was doing felt fine. So I'm not too sure, to be honest. Yeah, good question. I never thought about it. Maybe maybe it's correlated.
In case another lady says, "Oh, I don't like this position," then you might think maybe.
No, you know what? That's absolutely. I think maybe if somebody says to you, "No, this feels like it's pulling," maybe it could be like a little bit of a red flag where you can just kind of go, "Ooh, okay, let's do that little test for the diastases then, the one where you're lying on your back and then you feel along there."
And also about the WAG, is it a good reliever for the SIJ? Is it stretching that area? Because I know it, for me, it feels nice when I use it.
Absolutely. You know, I think it is. It's a lovely one to actually create a little bit of release along the sacrum. The only thing I would be aware of is if somebody does have one side of the sacroiliac joint that's out, that they might have very limited mobility to one side and a lot of mobility to, you know, the other. And then you might see that there's an imbalance there. So then I would actually advise them, just contain the whole thing. Make everything sort of like small and even on both sides. Yeah, because it feels good for me as well, you know. And I also, my SI joint can be very unstable on the left side. Cool. All right, guys, so those are our WAG and cat stretch. And the other thing as well is that these are only 2 exercises back to back, but don't forget that women may get fatigued quite easily. So keeping them in that 4-point position for an extended period could be a little bit of a problem. So just be prepared to go back into a resting position, take a little bit of a break at any point that you need to, so that, or maybe even just sit up and shake out the wrists so that they have a little bit of a break in between as well. Okay. And speaking of our resting position or our child's pose, this is on page 30. Everybody loves this. I don't know anyone who doesn't like going into the resting position or a child's pose. Now, again, when you take a look at this, you can see already that we've done 2 big modifications here. Look how we've taken the knees apart, okay? Because if baby bump is really big, you need to have space for the baby to come through between the legs, all right? So the knees have to come apart. And there's a very good chance that your thoracic spine or your whole spine is not going to be as mobile as it was, okay? Because already baby's pushing up into the diaphragm, the ribs are expanding sideways. You may not be able to get your head all the way down to the floor, which is why we've got these blocks ready to place underneath the head. What are some other modifications that you guys can think of that maybe we need to have ready for someone as we come into this position? Any ideas?
I would get a pillow for the head, just to relax the head and the back lower neck.
Yeah, so to do what with the head?
Well, basically, like we're doing yoga, it's just to obviously take the tension off. A lot of women can't get to the bottom and they'll feel they have to support the upper spine. The whole idea is to relax. So you can put a few bolsters up on the front, a few blocks, maybe come on a little bit higher, make space for baby.
Fantastic. Cool. So making sure that you've got the head supported, putting the arms wherever feels comfortable for you, not necessarily stretching them out, okay? And then also what you just mentioned right now as well is you might not be able to bring your pelvis all the way down to your feet. So then you want to be ready with having some kind of support underneath the pelvis. So you know what I actually quite like is to sit on this ball, because it's nice and soft, and you don't necessarily have to wedge it behind the knees, but it gives you a support underneath the pelvis. Although quite frankly, you could do just what we did a second ago. You could take like quite a big pillow. This one's quite hard, but if you took a pillow off your bed, it's much softer, and you can put it behind the knees, and it gives you some lovely padding so that you're not pressing onto the knees either. Okay, so guys, let's come into resting position. I want you to take whichever props you have available for yourself, and let's figure out how we might be able to use them appropriately. So some of the ways that I like to use these is, you can first of all, if you've got a pillow or a bolster like this, and you can get your knees wide enough to put them on either side, when you lie forward, it's a nice place to rest baby. And then you can just raise your head down, or you can turn your head to one side like this. It is incredibly soothing, because then you also have a space for baby to rest if your bum isn't that big that it's going to rest on the floor. So these cushions are fabulous, first of all. If you don't have this pillow or this cushion available, you could actually just use like a little block ready for your head to rest. And then, as I mentioned earlier, I like to put this underneath my bum. And you can see that immediately I'm not actually pressing onto my knees so much. And then you can come down and rest your head here, elbows wherever feels good for you. So guys, find your resting position, come into it, and we're just going to stay here for a few moments. And we're just going to bring our awareness to our breath, and then we're going to bring awareness to pelvic floor. So you want to make sure that you're in a comfortable position. And taking a nice, easy breath in. And as you breathe out, give baby a little bit of a hug. Lifting baby up towards you. And again, breathing in. And exhale, lifting baby upwards. And now we're going to think about the front pelvic floor. I will not weave. So taking a nice, easy breath in. And exhale, I will not weave, giving baby a little bit of a hug, and relax, breathing in. And exhale, front pelvic floor, I will not weave, finding your connections, and relax. And then you're going to slowly walk yourself all the way up, and lifting up nice and tall. So you can use the resting position or your child's pose in a lot of different ways. It can literally be a moment for you to relax, like take a weight off the wrist if you've been in 4 points. It can be pelvic floor. It can be an emotional connection to baby, creating space for baby, finding a connection to baby. It can be a connection into your breathing, or just maybe a chance to notice how you're feeling physically, emotionally. So lots of different ways that you can use resting positions. So you might notice as well when I do my classes, and more so when I teach pregnancy work, is that I incorporate resting pose at various places throughout the class, not just once. I'll actually probably do it 3 or 4 times, because it's such a nice way just to take a break in the class and then draw attention or awareness to some other aspect. Okay. Any questions? How did that feel? You guys pull out the props? Awesome. Good. All right, so what we're going to do now, I want to come into a little bit more of the twists and the waves. So we're going to move to page 34 of your manual. We're going to come back to the other exercises tomorrow. So this is on page 34, where we actually just do waves And this is from, look, I mean, you're going to find this movement in many different methods, but this is actually from gyrokinesis and gyrotonic. And it's just a lovely way to find a rhythm for your body to move through. And it's a way to take your spine into flexion and extension. So if somebody isn't comfortable on all fours doing the cat stretch, this is also a lovely way to incorporate that movement of the spine. And then from the waves, we're going to go into a little bit of a seated spine twist. And this is just, again, a flowing movement that you can incorporate. So both of them are going to be in a seated position. So again, for a lot of women who aren't comfortable sitting flat down, okay, maybe their lower back is taking strain, you want to be ready with either a bolster cushion, a block, or maybe even get them sitting on a large ball or on a chair, because that'll take them right out of their hips and their lower back here. Okay, so get yourself in a comfortable seated position. I'm going to be sitting on my restorative bolster, and I'll turn sideways so you guys can see what I'm going to be doing. And now you have a choice that you can either sit with your feet, the soles of your feet together, so it's like a butterfly position, or if you feel comfortable to cross the legs, you could sit this way as well. The only thing that I would say then is sort of halfway through, you want to switch your feet around, because you might notice that there's sort of a greater stretch on the one hip than the other side. Okay, so you can decide how you want to sit. Using your hands to offer yourself some support. We're going to start just by lifting up through the breastbone, and then just hinge forward a little bit, and then give baby a little bit of a hug. Round your spine, rolling back, and then lift up, lift the chest, and we lean forward. Give baby a little bit of a hug as you round the spine, and to tall. And again, connecting your movement to your breath. Now, don't forget that there's such a strong stretch that's happening. So a huge movement here to actually really feel those connections. Let's take one more time. And round. And sitting all the way up and tall. Good. So you can see the correlation between the cat stretch that we do on all fours or standing and those waving actions of the spine. Okay, so I'm going to put the ball back underneath so I get that sense of where baby is. And I'm just going to sit on a little bit of diagonal so you can see what I'm doing with my arms here. So now again, you can either sit cross-legged or you can have your legs out, whatever feels most comfortable for you. Take your right hand, place your hand underneath baby. So again, it's a tactile cue to engage the abdominals, but literally so all you're going to do is take your left hand with the palm up, and we're just going to reach up and back. And then we're going to dive forward. Palm up and back. Reach. And forward. And now, don't force your spine to do any particular movement. Let your arm reach up and back. And down. And you're going to find that if your head follows your hand, your spine is going to follow naturally. One more time, we'll reach up and back. And forward. I get people to change their feet because again, it just does a slightly different release at the hips there. So now, neck supporting baby. Right hand goes palm up as we reach back, and then we let the hand fall forward, almost like a little flowing river movement. Up and back. So what I love about this movement is that it's quite rhythmical. There's no right or wrong movement. So, you know, you might find some women do this with the palm down or switches to the palm up. It doesn't matter, because what you're doing almost without realizing it is mobilizing the spine. You're doing rotation of the spine, you're doing extension and flexion, and you're actually releasing the arm lines, and with that rotation, you're actually connecting into the obliques and the abdominals. But you don't even have to talk about any of that, because it's just going to happen naturally as you get women to move. One more time. And breathe. And release. And then sometimes I'll just get women to sit, hands on the baby, or they can do one hand to heart, and they can close eyes. And remember the breath work that we did? And then I get them to just close eyes if they're comfortable with that. And it's an opportunity to just notice the shift, notice the integration of the movements onto their body. And again, having that connection with baby and creating space for themselves and for baby as well. Okay. Cool. Okay. Really come up. So this was the first one here that we just did, were our waves. Lovely correlation to the cat stretch. Nice to be able to do this in a seated position. And then coming into the seated twist. So again, if you focus on the arm movement is going to move the spine. And so without even talking about the connections to the abdominals, women are going to feel the benefits of this movement as well. Awesome, guys. So, any questions on what we've done today? Everything making sense so far? Okay, fantastic. So guys, what I would like you to be able to do, did we just lose someone? Okay. So what I'd like you to be able to do today is just to read through again on hypopressives. Maybe you can watch that video again that I've inserted the clip, because I know that was a little bit soft. And that way, if any questions come up with hypopressives, that we can review that at our next session as well. What I want to see is that I might still have the video hooked up of how to check
pizza or salad?
Okay, no, that's not it. Okay, hold on a sec.
Which one do you think I'm
I
having
need
for
to
dinner
skip this ad. All right, so guys, I'm going to do a little bit of a screen share for you.
Hi, I'm Sarah. Today I want to talk to you about a diastasis recti, what it is, and how to check yourself for it. If this isn't something you're familiar with, a diastasis recti is the separation of the abdominals during pregnancy. Now everyone is going to have some sort of separation, but if it's significant, more than a 2-finger gap, and I'll demonstrate what that means here in a little bit. But if it's more than 2 fingers, it's what you call a diastasis recti. So Here's your abdominals. You have your rectus. It's your outermost abdominal muscles. Behind that, you have your transverse abdominis. And on the sides, you have your obliques. Holding those muscles together in the middle is tissue called the linea alba. During your pregnancy, that tissue is going to thin and it's going to stretch to allow your muscles to do the same. Now, if that tissue stretches too much, you have what we call a diastasis recti. The problem with this situation is if it does become significant, you're probably going to continue to look pregnant. You may have some low back issues, and if it gets really bad, sometimes it can turn into a hernia. It's like any other injury that you have. You just want to heal it so that you can live a normal life and know that your body is intact. And it's really important that we check ourselves for this, especially if you're going to continue having babies, because you really need to heal those muscles before you get pregnant again. So here is how you test yourself for it. It's called the finger test. I have another video out where I'm pregnant and I'm testing myself for it, which is really interesting because if you are pregnant right now, you can kind of see physically the signs of what a diastasis looks like. The only problem is that when you are pregnant, it's harder to get an accurate read because you have a baby inside you. So today I'm going to show you how to test yourself for the diastasis. Roll down onto your back. Remember, you're going to want to roll down on your side first and then onto your back. That's the safest way to do it post-pregnancy, especially if you're suffering from a diastasis. From there, put one hand behind your head. I just want you to lift up. Really dig into your navel with those fingers, and you're going to want to have your fingers be horizontal as you press down and see how many fingers that you can fit. Now you'll see I'm kind of like almost 2, it's more like 1.5, and then I'm going to check in 3 spaces at my navel, and then about, I measure with my fingers, 3 inches-ish down below my navel, and then 3 above. And my gap is closed, practically closed at the bottom. I'm about 1.5 in the middle, and then my most significant gap is actually near the top. So that's why it's so challenging to heal a diastasis, because it can be a different width in each section. If you have anything more than a 2.5 finger gap, it is technically considered a diastasis recti. However, if you have less, I really do encourage you to start doing exercises or avoiding exercises, and I have videos on both of those, that would possibly make your diastasis any worse, or if it's not technically a diastasis, make that gap become any worse. Because your body is in a sensitive place during post-pregnancy, you can make that gap worse. So there's really exercises that you want to avoid, and then there are some really great ones that you can do to start to kind of rehab your body as well. So please check out those videos so that you can make sure that you're healing your body in the best way possible. If you have more than a 2.5 finger, and I would even be cautious to say if you have more than a 2 finger gap, I highly recommend that you check in with your OBGYN or midwife, as well as a pelvic floor specialist, and start to do some physical therapy. If you're looking for a workout to do, I do have a DVD called Expecting More, the 4th trimester workout. And if you're recovering from a diastasis and you've been given the okay to exercise, all the work that I have in that video is safe for a diastasis recti. In fact, one of the girls that's in the video, that's my backup, she does modifications that are specifically for somebody with a diastasis. So definitely check that out as well. If you have any questions, please leave them in my comment section below. Make sure definitely to subscribe to my channel, because I have had a diastasis myself. I have all sorts of material that I'm constantly releasing as I look.
All right, so the rest of it is really about her YouTube channel. But so you can actually see there how she was testing, and I thought it was great as well that she showed when she was pregnant, how you can test during pregnancy as well. But sort of the classic hernia that people might get is around the actual belly button, the umbilicum. But then you want to test a little bit lower down towards the pubic bone, and you want to test a little bit higher up towards the sternum, because you can have different degrees of separation at each of those spots as well, which is what I have mentioned to you, is that I've got quite a big separation around my belly button, and then it's a little bit narrower as I move away. But in fact, I've got more separation up towards my sternum than down to my pubic bone. So, it just kind of gives me information about what I need to focus on and what I also need to avoid as well, okay? and all that loading. Guys, are you all good with the information today? Fantastic. Okay, so homework, read up again about the hyperpressors. I've given you the link in the chat box there as well. And then test yourself for any kind of separation. Notice where you might be getting it, how big the separation might be, and then we can chat about it on Tuesday. And on Tuesday, guys, we're gonna finish up all the repertoire. We're also gonna talk a little bit about the baby blues or postnatal depression, like what's the difference between them. And then on next Friday, you guys are going to be doing mini teaching with each other. Yeah. So don't worry, I'll give you lots of prep time for that, and you can mentally.
And we have to do it on Zoom with each other.
I'll do little breakout rooms with each other. So 2 of you or maybe 3 of you will be together in a room, and you're just going to do little teaching for each other and give each other feedback.
Okay.
Okay.
Yeah.
Fun.
Have an amazing weekend, and I'll see you
Thank
on
you.
Tuesday.
Thanks, Renee.
Thanks so much.
Bye.
Bye, everyone. Enjoy your weekend. Bye.